wife, and mental health professional. I can attest both personally and professionally within the birthing experience. I experienced a wide range of emotions and thoughts as a Black mother with both of my pregnancies, with my oldest son at the hospital in April 2018 and my youngest son's unexpected home birth, delivery, and health scare in January 2022. During birth experiences, I was privileged, to say the least, with support of family and friends. The capacity to advocate on the behalf of myself and my children as a licensed clinical social worker, and the feasibility to seek mental health services with my health insurance. Nonetheless, distance of self-advocacy or affordability of outside sources should not fall on the mothers. There was a statistical report conducted by the Center of Disease and Control in 2022, which stated that Black women are 3 times more likely to die from pregnancy-related causes than white women. Let's analyze that. In 2018, the maternal mortality rate was 17.4 deaths per 100,000 live births. Then in 2022, it was 23.8. There was an extreme impact among Black and Indigenous communities. Furthermore, Black women were more likely to die from live births at 2.6 times compared to white women, and then 2.5 times compared to Hispanic. Also, it's important to note that the majority of maternal deaths occurred after delivery. So research illustrates that it's estimated that 22% of maternal deaths occurred during pregnancy, 25% occurred on the day of delivery, 23% occurred approximately 7 to 14 days postpartum, 30% occurred in the last postpartum period, which is between 43 to 365 days postpartum. I would like to note that 4 out of 5 of those maternal mortality deaths were preventable. Black and brown mamas are already carrying the mental, emotional, physical stress of navigating implicit bias within the healthcare system. Also trying to locate cultural competent birthing providers and their healthcare insurers if applicable. And then self-advocacy on top of the notion of death and dying, then during delivery, and then the sense of locating positive support systems. So these forces stem from various factors, as we all know, especially with racial disparities and discriminations when we examine the quality of the healthcare system, underlying chronic conditions, which we talked about earlier, structural racism, and implicit bias. In order for change to occur, we must take action to change the policies and systematic barriers that impact Black and brown mamas, as well as the implication of effective screening during prenatal and postpartum care. We need to increase healthcare visits with different or multiple medical care professionals, and then look at the quality of the healthcare coverage to cover unexpected costs and fees. Furthermore, effective research and investment in local birth workers are essential as well, whether it's with doulas, midwives, maternal mental health therapists, and childbirth educators. Woo-hoo. In Michigan, we have several different local organizations who are working relentlessly advocating for policy changes, included but not limited to Mothering Justice, Birth Detroit, State of Justice, Nature's Playhouse, Revive Health Community, Great Lakes Prenatal Wellness, and the list can go on. As a maternal mental health therapist, I have become an active member of the Prenatal Mental Health Alliance for People of Color. We believe that representation does matter, especially in the prenatal mental health realm. Whether it is as a maternal mental health therapist, a midwife, a doula, etc. The vision and the mission of this organization is to expand access care and support for prenatal mental health care for people of color in their community. This is also accomplished by providing affordable training for professionals in the prenatal mental health field, and working closely with Postpartum Support International, PSI, in order to facilitate the discussion of the barriers, including racism, equity, and oppression. Being a part of this group has provided me access to network with Black and brown and Hispanic and Latino heritage maternal mental health professionals across the USA, as we collaboratively work together to be effective change agents in our communities. If you're interested in joining, there is a link on the postpartum.net website. Thank you for taking time out of your busy schedule to listen to all of us speak and provide a perspective of our birthing experience.